What kind of trends are we seeing in plastic surgery from an implant standpoint? And are bigger implants going out and smaller implants coming in? And the answer is yes, we're starting to see some trends that way. Patients are definitely coming in wanting smaller implants, wanting to downsize their implant, not necessarily wanting as big of a breast shape as, a few years ago. So again, trends come and go. Patients have individual desires, but overall, we're starting to see desires for smaller breast sizes. We get a lot of questions about what size implant looks natural on my body. And the answer is it's going to be very different from individual to individual. It depends on a number of factors: the starting amount of breast tissue, the width of the chest or the base diameter of the breast, the look that the patient is going for. So natural can be variable from person to person, their opinion of what natural looks like. So there's a number of factors that go into really determining what's right for that individual, and that's where the consultation is so important. Spending time, sitting down, really getting a good idea of what that patient not only has from an anatomy standpoint, but from a desire standpoint. So the newest implant on the market in the United States is an implant called Motiva. And this is a company that's based out of Costa Rica that has been introduced into the United States now about a year and a half ago. It is a great implant company. They have changed their implant just a little bit. They have some microtexturing on the surface of the implant that is thought to help reduce some capsular contracture rates, thought to help reduce some of the immune reactivity of the implant. They have a very strong gel, so the rupture rates are exceptionally low. And they've added a little bit of a blue dye, a blue tint to the implant too, to make it a little bit different, but also to help us see if there are any manufacturing issues, if there's any cracks in the shell, to help us identify if there's a problem before we put an implant in. So it is a great implant. It is a great addition to our armamentarium of options for patients, and options are always great. How do we decide whether we put an implant above or below the pec muscle? And the answer is really dependent on the amount of breast tissue that a patient has. Probably the most important factor: how much tissue does a patient have in the upper aspect of the breast to be able to hide or camouflage the implant? If we put an implant above the muscle, we want to make sure that we don't have a lot of visibility of the implant. We don't have a very abrupt takeoff of the implant. So we look at upper pole volume, upper pole tissue. Patient desire is also another factor. There are downsides to putting an implant under the muscle. The under the muscle implant will have some movement or animation. So it's a discussion that we have with patients and really see what's suitable for their lifestyle, for their anatomy, and if they have any other factors that they want to consider. A common question that we get from patients regarding breast augmentation is whether there will be any changes in sensation to the breast or the nipple. And in general, there's minimal to no change. It can happen, however, and we often will see it with really large implants. So if someone has a small breast, we put a large implant in, that's going to stretch on those nerves a bit more. So we can see some changes, but again, it's quite uncommon that patients have any significant changes. So how long do breast implants last? And the answer is that there is no absolute expiration, especially on silicone breast implants. So the general lifespan can be 20, 25 plus years. We have some protocols that we can use to follow up on implants. So if we have questions about implants, we can look at them with an ultrasound or an MRI to see the condition of the implant. But in general, there's no 10-year timeline or 15-year timeline where they have to be removed. As long as the patient likes the look, the feel, the shape of the breast, and the implant is not ruptured, the implant's in reasonable shape, which again, we can assess with imaging, it's okay to keep that implant in place until the patient wishes to either remove it, replace it, etc.